appreciate your contribution for NHS because being a doctor, you have worked with you are part of the NHS. Now you're working as a consultant in a like a freelance. So please also share your experience because your father was also a poet, and so what kind of poetry was his subject? You know, what subjects he has touched upon?
I mean, he was a religious poet in a very traditional sense. There is a form of poetry in Urdu literature called Marsiya. This is basically written in commemoration of grandson of Prophet Muhammad, how he stood for the truth and he gave his life and his sacrifices. And there is a big tradition, especially in Urdu literature, people writing poetry around those sacrifices. And those tradition of marsiyas are these are long poems, as you know. So my father was a significant name in that sort of kind of religious poetry and in those circles. For me, as we were growing up, he always advised to give priority to education, and anything else would come later. So in my life, becoming a doctor, yes, for a period of time, I tried something else, but my feelings for the human beings and to work for them brought me back. And working through the NHS has been an immense experience. Yes, later on in life, these days, I have been working mostly in private sector, but we deal with the patients which NHS is unable to deal with, more complex and more complicated issues. I mainly deal with forensic patients, that is those who come to the mental health side through. So all those people who are in legal services at the point of prosecution or after being prosecuted. So it's an interface between mental illness and offending behavior. So these are very complicated mental health issues which we deal with. Uh, I forgot what your original question was.
It was about NHS, but now we move forward. So at the moment, if we will see the society, especially during last 2 years, during COVID, so what do you think, what kind of impacts the COVID is leaving on the patients and especially people who are catching this virus? So there is a one impact on your body, but the most important impact is on your psychology. So as a doctor, what you see, what kind of impacts you have seen during your experience?
Yes, I mean, COVID-19 has, apart from how it is affecting physical health of the individuals and how it has affected human race overall, it has affected both our social behavior and how you feel about things, and how it has affected your mental well-being. Socially, there is some positive aspect of it. People have learned to be with the family, I mean, spending more time with them, and has again found value of it, which is a positive thing, which is a good thing. But at the same time, human beings as social beings have been going through long periods of isolation, and that is a big predisposing factor for all sorts of mental illnesses. So there has been an upsurge in people presenting with anxiety disorders and with depression, and that has a big impact on mental health services as a result of COVID-19. For me personally, because these are the mental health issues which present usually to NHS and to general psychiatry, I didn't have any direct experience of that. As I say, working in a sort of tertiary services where I deal mainly with long-term issues, more complicated issues, and with the patients who have who come from prison and who are on various detained under various mental health act sections. There was a big impact in another way because we are dealing with a community of patients in a long-term living conditions. There was an impact on how many times patients can go out to the community. And in that respect, I saw all those mental health issues among that group of patients that I have been dealing with in number of hospitals. So resulting from isolation and resulting from restrictions around their movement, they did show all those depression as well as relapse of their original mental illnesses like
I've also a very important question, the quality of education. So do you think as a psychologist that online teaching or learning system as compared to student present in the class or in the lecture room, so does it makes difference or in your experience or being professional, so what do you think, the quality will be the same or it will also affect the learning ability of the students or pupils?
I think again during these years most of meetings became online meetings, which now we feel is a better option rather than long travels and time wasted in it. So a lot of professional meetings are taking place online. Education is also, I mean, as doctors, we have to keep a certain level of hours within a year. We need to be involved in teaching and training activities that they have all been now taking place online. Yes, it has largely filled the purpose, I say, for professional purposes. But when you are a student in university and even postgraduate students, I don't think online learning could fulfill all that what we need, and face-to-face learning, learning within a group of students or among others is a much more potent and a useful way of learning compared to just online learning. Yes, students these days have suffered, I think, a lot, but hopefully things are getting better and they will get better.
Dr. Qaiser, you are part of different literary societies. Please share the name of the few literary societies you are part of them, and also your experience and what kind of activities you arrange, and how the youngsters, people who are interested in literature, can connect themselves with these type of activities.
I have been involved not only in literary activities and number of organizations, literary organizations, but also I've been involved with some professional organizations very actively. I've been the chair of British Pakistani Psychiatrist Association. It's a big association for 3 years, and successfully arranged academic programs, teaching, training, conferences. When it was lockdown, these were online, and I've been actively involved in liaising with Royal College of Psychiatrists and other diaspora organizations, Pakistan Psychiatric Society, etc. And also many literary organizations within the UK promoting Urdu literature. Most notably, Yorkshire Adabi Forum is a very active organization, very well recognized all through, over India, Pakistan, and England. There are some other organizations I've been associated with. Basme Sukhan, it's from South Yorkshire. They are working to promote Urdu and Urdu literature. But in the process, I have also come in contact with literary organizations promoting English literature through a very good friend and a very well-known poet, Basir Kazmi. Ilkli Literature Festival is one of them. It was good to see people from Urdu literature working along with people from English literature. And these are the activities that when you are involved in it, you feel the other side of you. As I said earlier, you have an aesthetic side and you have a cognitive side. So you cater for everything. And I feel for the purpose of self-actualization, at least in my case, and I would say for everybody, a bit of everything is important. And especially art is where you find your ultimate self-actualization. And I will suggest it to everybody. Being involved in artistic activities would definitely and greatly help you in advancing yourself in your professional careers, as well as advancing you as a human being, I would say.
In recent years, Bradford University has started the Sufi music evenings. So what is your thoughts about that? Because that is also a good mode of promoting the literature between two countries.
Yeah, definitely. And I mentioned earlier, Yorkshire Adabi Forum, they are very intimately or very closely working with this program from Bradford University. And there are poetry sittings where people from both sides, they come together. And especially younger generation of Pakistani families are coming up with a lot of literary activities in English language. So we through those gatherings, we try to bring everybody together. And these sittings and programs are very successful.
You have now we're going back to your experience being in civil service officer. So you have dealt with of course, the different offices and the bureaucracy in Great Britain. So please share your experience dealing with the two different systems. So what these two systems can learn from each other, and what qualities can be, I will say, can be introduced when the training courses are given to these young officers in both countries. So is this kind of experience you want to share?
Yes, I mean, these are two societies which with two different way of expressing themselves, two different dynamics, I would say. From Asian societies, we are more passionate people, more emotional people, and what I have learned from working and living in the UK, that uh, uh, there are some things which are extraordinary here, which we all need to learn, which is uh, respect for your work, respect for human beings, human dignity, and equality and diversity. These are the issues which this society, the way they deal with it, the day they use these things in progressing, especially around governance, building institutions. That is something that probably we, as Pakistani, I'm saying, we need to learn. Working in civil services and in some hospitals in Pakistan, I thought that there has been some room to improve in terms of how you manage your work and how committed you are. Probably there are some socioeconomic reasons behind it, but that's one thing I felt, that focus and commitment to one work or one profession that you are in. I found that there was room for improvement there, and over here I felt people choose professions and the work they want to do because they want to do it, not for economic reason. And when they are in it, their dedication, their focus is really something to be admired. And that's what I have learned from this society. Love your work and deal with your time effectively, manage it properly, and respect human beings, give equality, and accept diversity. That's something I really admire and I have learned from this society.
But when I put forward this question to different people, mostly people complain about the resources, as you mentioned, that sometimes people say we have a not as resourceful or not as full of resources as Great Britain is. But I think changing some tradition doesn't need a lot of investment. So, yeah, as you mentioned, these qualities, so these could be part of the training course.
Yes, I mean, as we know, people come from that part of the country in this country to get education, to get training. So I would say, yes, take that knowledge back, but also take those attitudes and attributes as well. And as you just mentioned, yes, resources could be one issue, but it's not the whole issue. The whole issue is judicious use of your resources. And that can only come through from changing yourself and changing your level of commitment and your level of best use of your resources. That includes time, money, and everything, as best as you can. Yeah, that's what everybody should learn who comes here for training or education and goes back.
Dr. Qaiser, do you have any inspiration from any English poets?
I mean, I mean, from classical side, Ghalib inspired me the most. Within the family, the three poets who used to be discussed the most was Mir Taqi Mir, then Ghalib, and then Iqbal. I would say in my personal life, starting from as a student, Iqbal has been the mainstay. And the way he addresses the young people and the way he propagates the concept of the struggle, Jihad-e Musalsal, and I just used to memorize his poems and used to get inspiration. And I used to use a lot of his poetry and couplets in my speeches, which I used to do as a debater representing my university. Um, like हर एक मकाम से आगे मकाम है तेरा हयात ज़ौक़ सफ़र के सिवा कुछ और नहीं. It's just very inspiring that every destination that you get to is the start of another journey. So the whole life is nothing but a journey. And as a young person, this couplet just was very inspiring for me.
As you mentioned your friend's name, Mr. Pasir Kazmi, because he's also a very keen observer of English literature as well. So you have studied any English poets as well?
I mean, not as a subject. Basir Kazmi has has his education, graduation, post-graduation, and further research around English literature. As you say, my profession, as I said, my profession is medicine. So no, I have not studied it in a formal setting, but I have read around it. I have, especially my wife, who is also a psychiatrist, but she is brought up in Manchester, and she is a graduate of Manchester University. She has a very keen interest in English literature, and whenever we have time, we discuss and we compare, and sometimes we debate and we argue what is better in Urdu literature and what is better in English literature. So yeah, in that way, it has been something I've been in touch with.
But one point agenda is same, the reflection of society. So literature will reflect wherever it is. It will reflect society, its norms, and sometimes it also helps to recover the problems and the shortfalls of the society as well.
Yes, definitely. Nothing is perfect in this world. Yes, I don't like to use the word East or West. I would say that there is a continuous evolution of ideas, right? Yes, evolution is takes you to a better understanding of things, but evolution in its own theory, where Darwin started it is not always without pitfalls. So you progress, but you also end up leaving something. So if progressing societies develop this habit of stop for a moment and look back, is there anything that they have lost, right? So I would say there are societies which are evolving and some societies which are evolved, and there are segments within the society as well. So we all need to continue to progress, but at the same time, stop from time to time and look back. Is there anything that we should not have left, we should not have done with, and if possible, can we get it back? I mean, in practice of psychiatry, there's a big, huge, my wife is a consultant in child psychiatry. The whole child psychiatry is basically good parenting. And there are lots of African professionals working in it. And one day, that African lady I was talking to, a ward manager, she said to me that all I do is tell them African values. I laughed and I said, yeah, people from Asia will say Asian values, but they were also Victorian values. So I would say the traditional values. And these days, yes, family system is disintegrating, has disintegrated. It has profound impact on the mental well-being of the children. And we as a society, as I say, we must continue to progress, because progress is bringing better values, better human management. But at the same time, we need to make sure that is there anything valuable that we are losing in the process? Can we manage to get it back and bring it in our lives?
Very beautiful phrase, At the end, I will request Dr. Qaiser to give a message for our viewers.
I mean, my main message, which I always like to share, is for me, keeping an open mind is the main thing that I try to keep. Again, maybe because I have a very traditional upbringing, but a very fortunate to have education which was which taught me freedom, liberalism, equality, and yes, we tend to see things from certain perspectives, some backgrounds, and try to take sides and say this is wrong and this is right. I try to understand rights and wrongs, but I don't like stereotyping. And what my message for everybody would be that when you are looking at different value system and different thought processes and different attributes and attitudes, you can choose what is right and wrong for you, but you must respect everybody for what they are. That would be my message.
Message that respect others, their thoughts, their values. Viewers, this was a great interaction with our honorable guest, Dr. Qaiser Abbas Zaidi. Thank you very much. Keep watching Sheffield Live.